Welcome back to your Pediatric Dentistry channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel visit the bio section, or you can also check out my first video. Sorry if there is any mistakes in videos or shorts. Today I'll cover the third part of radiographic technique in pediatric dentistry. So starting with the radiographic protocol. When a new patient is seen at the dental office and no previous radiographs are available, it may be necessary to obtain a baseline series of radiographs which is governed by radiographic protocol. So this is the age, consideration and radiographs needed to be taken. If the age of the patient is between 3 to 5 and no apparent abnormalities and open contacts are there, then no radiograph should be taken. No apparent abnormalities but there is a close contact, then two posterior between radiographs, one left and second is right side, because proximal caries is difficult to detect with the naked eye in the close contacts. If there is extensive caries, then 4 film survey should be taken. Film survey will be discussed next. When there is a deep caries, then 2 bitewing of size 0, 1 periapical included the tooth with the deep caries, and 4 film survey. If the age is between 6 to 7 years and there is no apparent abnormalities there, then there is a 8 film survey. And if there is an extensive caries, then selected periapical x-ray with the 8 film survey. If the age is between 8 to 9 and no apparent abnormalities should be there, or there is extensive caries should be there, then 12 film survey should be taken. If the age is between 10 to 12 and no apparent abnormalities or the extensive caries, then 12 or 16 film survey should be taken. Coming to the radiographic survey. So to accomplish the task of radiographic protocol, specific x-rays are needed to be done at each age. These x-rays are mostly individualized for each patient, and depending upon age and caries, it may be classified as a 4, 8, 12 or 16 film series. And this entire set of x-ray series is called the radiographic survey. 4 film survey, which include the maxillary and mandibular anterior occlusal and 2 posterior between radiographs. 8 film series is the maxillary and mandibular anterior occlusal, right and left maxillary posterior, right and left mandibular posterior and periapicals, and 2 posterior between radiographs. This is the maxillary and mandibular anterior occlusal, then 2 periapical radiographs for maxillary and 2 for the mandibular, and the one on each side for the between radiographs. 12 film series is a 2 primary molar and premolar periapical radiographs, 4 canine periapical radiographs. This is the 4 canine periapical radiographs. Then there is a molar periapical radiograph plus 2 between and the maxillary and mandibular anterior. And 16 film is the same as the 12 film survey, 4 permanent molar radiographs. Coming to the panoramic radiograph, it is also known as the orthopentomography. Orthopentomography combines the ortho means the straight or correct, pento meaning all the entire, graphy meaning the imaging or recording. So this name reflects the technique's ability to capture a wide, detailed image of a dental arch in a single film. Then maxillomandibular radiography, because the whole maxilla and mandible captured in a single image. Then pentomography, which is same as the orthopentomography. Rotational tomography, because it involves the rotation of the X-ray tube and image receptor around the patients. The use of mechanism by which the X-ray film and the source of X-ray move simultaneously in opposite direction at the same speed. Coming to the indications, so if there is condylar fracture, traumatic cyst, evaluation of tooth development in a mixed dentition, developmental anomalies, disabled child. Coming to the advantages, so there is a broad anatomic region image, relatively low radiation dose, convenience, speed and ease, useful in the patients who are unable to open the mouth. But there are disadvantages. The first is a lack of image detail for the diagnosis for early carious lesion. Cost of X-ray machine, overlaps image of the teeth, staying completely immobile for 15 seconds may not be possible for very young children. Coming to the uses, it is used for the evaluation of the gross carious status, assessment of advanced bone height, extensive cystic and tumor cases, assessment of the mixed dentition, overall assessment of the bone pattern, fracture, preliminary assessment of maxillary sinus disease, general assessment of condyles, morphology pathology, pre and post-operative evaluation of oral surgical procedure and orthodontic treatment, changes in the alveolar bone due to the systemic disease like leukemia, Paget's disease, evaluation of third molars to assess the lesion in the edentulous jaws, to assess the radiographic assessment of implant site, patient who have a gagging sensation to intraoral film, we can use the OPG, ankylosis of temporomandibular joints, patient with the restricted mouth opening, and evaluation of the tooth development. If you have to include OPG when there is a question of extraoral radiographic techniques, which include the panoramic radiography, skull projections, which include the reverse down, submental vertex, PA view, PNS view, lateral cephalogram, hand and wrist radiography, cephalometric radiography. Coming to the specialized radiography, the first one is the xeroradiography. So xeroradiography is a method of imaging uses the xeroradiographic copying process to record images produced by the diagnostic X-rays. So in a simple word, these involve using photoconductive plate, which is made up of selenium, that gets charged and then exposed to X-rays. The X-rays create an electrostatic image on the plate, which is then developed using a toner powder to make the image visible. The imaging method was discovered by an American physicist, Chester Carlson, in 1937. Pogorzelska Stronzak became the first to use the xeroradiograph to produce dental images with extraoral dental use in the cephalometry, xylography, and panoramic radiography. So this is the basically plate which is used in the xeroradiography. This plate is made up of the 9.5 into 14 each sheet of aluminium, a thin layer of a vitreous or amorphous selenium photoconductor, an interface layer, and an overcoating on the thin selenium layer. The first is the aluminium. Aluminium is used as a substrate for the selenium photoconductor, which should be present as a clean and smooth surface for the stable conduction of charges. Then there is an interface layer, which is a thin layer of aluminium oxide produced by the heat treating of aluminium substrate between the selenium photoconductor and the aluminium substrate. As a non-conductor, the interface layer prevents the charge exchange between the substrate and the photoconductor surface. So this is the interface layer. Now then there is a vitreous selenium layer. So selenium coating has a thickness. The thickness of this layer varies from 150 micrometer for powder toner development plate and 320 micrometer for liquid toner development. It has a property of electrically conducting when exposed to the X-rays and ability to insulate when shielded from all sorts of light. And then there is a selenium overcoating. So selenium protective overcoating or the coating. The protective coating is a 0.1 micrometer cellulose acetate overcoat. The coat bonds intimately with the selenium photoconductor. It helps to prevent the degradation of electrostatic lateral image through the prevention of the lateral conduction of electrostatic charges. Also, it impacts positively on the self-life of the xeroradiographic plate. Now, how it works. So, xeroradiography is an electrostatic process we know which uses a amorphous selenium photoconductor material, and this is all the material and form a plate. So, this is how plate is made with the different layer with the different materials. Now, this plate is enclosed in a light tight cassette, may be linked to the film used in a halide based technique. The key functional step in the process involve the sanitization of the plate in charging station by depositing a uniform positive charge on its surface by the corona emitting device called scoroton. Scoroton is basically a device which is deposited positive charge on the surface of the plate. So first we have to depositate the charges on the surface of the plate, and then the photoconductor conduct its electrostatic charges into the ground base in portion to the intensity of the exposure. After charging, the cassette is inserted into the thin polythene bag to protect the cassette and the plate from the saliva, and then the latent image is generated and then developed through an electrophoretic development process using liquid toner. The process involves the migration and the subsequent deposition of the toner particle, which is suspended into the liquid onto the deposition under the influence of the electrostatic field force. So basically the negative charges of the toner is met with the positive charges of the photoconductor, and the latent image is made visible, and this image can be transferred to a transparent plastic sheet or the paper, and the toner is thereafter fixed to a receiver sheet onto which a permanent record is made. Coming to the advantages. So elimination of the accidental film exposure. So large light intensity is required for photoconduction, and even when there is exposure, the charge area intrinsically get erased. As a result, there is a minimal need for storage for film protection during the processing. Also, there is a high resolution. Xeroradiography has excellent characteristics that forces around the electrostatic charges which form the latent image of high resolution. Simultaneous evaluation of the multiple tissue. So because the technical record tissues of differing thickness and densities of the xeroradiographic, there is a evaluation of multiple tissue from the one image. Ease of reviewing. Use of reflected or transmitted light is allowed by the xeroradiography. So image can be mounted either in a transparent plastic sheet or a opaque paper, which is very easy to use. Better ease and speed of production. No special skill are required. Darkroom requirement are unnecessary, and the entire xeroradiographic process may be completed within 60 seconds. Economic benefit when compared with the halide radiograph, the expenditure is 1/8. Reduce exposure to radiation hazard because there is no need to make it multiple exposure, as a tissue of different densities and thickness can be recorded in a one exposure. Patient is at a very low risk of the radiation hazard. Wide applications. Generally, xeroradiography has an interesting application in the management of the neoplasm of laryngeal area, memory and joint region, as well as an encephalometric analysis. But there are disadvantages. The electrostatic charges in the xeroradiographic process stand the risk of being lost in the confined, humid oral environment. Technical difficulties are there. Fragile selenium coat. Selenium coat may be fragile anytime. Then transient image retention. This means that the image produced by the xeroradiography are not permanent and can fade over time because of the photoconductive material such as the selenium, which can lose the stored charge relatively quick, leading to the gradual disappearance of the image if it is not processed and fixed promptly. And slower speed. Xeroradiography generally do not takes longer time to produce image, but the slower speed can be due to the additional step involved in the process, such as the charging the photoconductive plate, exposing it to X-rays, and then developing the image using toner powder. So these can make the technique less efficient for high volume imaging needs. Coming to the salography, it is the radiographic examination of the salivary gland. It usually involves the injection of a small amount of contrast medium into the salivary duct of a single gland, followed by the routine X-ray projections. So what is the procedure? The first preoperative radiographs are taken, then contrast media is filled with the gland till the discomfort and back pressure is felt, and radiograph is now taken to show that the contrast media is in the gland or not. Then the patient is made chew lemon to aid salivary secretion, because after the contrast media is injected into the salivary ducts, chewing on lemon can help to flush out the contrast media by promoting saliva flow. This helps in obtaining clearer post-operative images to ensure that the ducts are properly visualized. Then final radiographs are taken. So these are the branching structures like tree of the normal parotid gland. Then there is a filling defect, which is the salivary caliculi appearance. Then there is a normal submandibular gland, bush-like appearance. Then dots of media between branching of gland, which is the inflammation of the duct. Then there is a Jogren syndrome, which is visible as a huge dots of media between the branching of gland like cherry blossom appearance. Coming to the indications, in the evaluation of the functional integrity of the salivary gland, in the case of obstruction to evaluate the ductal pattern, in the case of facial swellings to rule out salivary gland pathology, in case of interglandular neoplasms. Coming to the contraindications, so persons who have allergy to iodine or the contrast medium we cannot use. Cases where there is acute infection, patient with the thyroid function test when calculi are located in anterior part of the salivary gland duct, because it causes blockage and the contrast media cannot be reached there, or there might be some defect in the radiograph. So usually the radiographs are taken lateral oblique view of the face and used for diagnosis of the foreign body calculus and tumor in salivary gland. So water soluble contrast media, which include the Conore 480, high opaque, renagraphene. Fat soluble media are ethodol and lipiodol. Fat soluble contrast media used in a condition when there is a need for the prolonged retention of the contrast agent is needed. So in pediatric dentistry, I am not covering in detail of radiography. I am just explain topics which is there in the book of pediatric dentistry and needed for knowledge and exam point of view. Stay tuned for the next part, which include the radiation protection, radiographic infection control and behavioral consideration, pedodontics, radiography. If you want this PDF or any other PDF, just like, subscribe and comment your mail ID with the topic and I'll send you the PDF. New videos on Thursday evening 6 p.m. and Sunday morning 11 11 a.m. Also, we try to put MCQs according to the topics on our shorts with the answers and explanation if needed, which will help you in a Viva or NEET exam. Like, share and subscribe the channel. Thank you.